Jack, like one of the problems we face is like many or most of the patients we see have many risk factors. You know, there are many different things. There are demographics, there are mental illness, there's interpersonal situation, and so on. So how should we think about these risk factors to make sense of it? Because simply listing all the risk factors is not really that helpful.
Yes, Raj, excellent point, excellent question. And so when you read about suicide assessment, you will often see these lists. These are the risk factors, and you sometimes in some books they will even kind of like put them in the table that you can kind of
Right.
in a systematic go over them, and that's fine. And I think that's actually a good place to start. But then the question arises, okay, well, what do I do now? So let me answer, I have two things to say about it. Number one is, yes, go ahead and assess the risk factors. Number two, though, assess the protective factors. But when you do that, you're still left with a list of like all the bad stuff and all the good stuff.
Yeah.
And then like, okay, what do I do now? How does this list, I've checked off certain things here. How does that translate into a professional judgment of like what I think the patient's risk is? So it's not like, oh look, they have 10 risks that they endorse and only 3 protective factors, so oh, they must be at high risk. It's obviously not that simple. It's not like let's just weigh the or count the number of risk versus protective factors. Because every individual they will have some unique or personal risk factors. So when you see these risk factors in books, those are what you can call population-based risk factors.
Correct.
Male sex, certain age, middle age or older age individuals, people who have had a suicide attempt in the last year. There's different risk factors. Having a psychiatric disorder obviously increases risk. So there are these population-based risk factors, meaning like when you compare people, when you do studies and you compare people who died by suicide versus those who didn't, those are risk factors. That means those people had higher rates of those factors, and so those risk factors, they're associated with increased risk of dying by suicide. So for every individual, they may have some very specific things that really drive the risk of suicide. So for instance, like for someone who has a psychosis, their main driver of suicide may be that they have command hallucinations to die by suicide. Or maybe it's not so much that, but they have certain delusions.